Hello, everyone. Thank you so much for tuning in to our second annual Tick Talk. As the weather starts to get, I know I keep saying that and people think I'm doing a TikTok, but this is more important because this is a talk about how to keep yourself safe from ticks. As the weather gets warmer, of which we're enjoying beautiful weather today and this week, but as the weather gets warmer, we want to spend time outside. We want to enjoy time outside with our family, with our friends, with our pets, but it's really important to know what navigation we should use and what things we should do to keep ourselves safe. And so today we've gathered a panel of local experts to share their knowledge about tick biology, ecology, and tick-borne illnesses, how to prevent tick bites and to check for ticks, and what to do if you find a tick and how to treat tick bites. Some statistics that I think really show the importance and the need for this conversation and so much more work in this space is the fact that for over a decade, New York has been one of 10 states with the most Lyme cases per the CDC. The Hudson Valley has an above average level of Lyme disease cases, with Ulster and Dutchess counties being the hardest hit. And Dutchess, Ulster, and Columbia counties have some of the highest number of back-legged ticks, which are deer ticks, in the entire state. There's a lot of work for us to do. I actually think the state needs to do more in terms of funding and awareness, but we have been doing some things. And so just in the budget this year alone, we allocated nearly $70,000 for services and expenses of research and prevention and detection of Lyme disease and other tick-borne illnesses. In the Ag and Markets line, we allocated $50,000 to Central New York Lyme and Tick-Borne Disease Alliance. And for DEC, we provided $12.75 million for tick population control projects to prevent the spread of tick-borne illnesses. And we know we need more money for research. It's actually something that is on my radar and that we want to continue to fight for in the budget next year to up some of these lines and even provide some more funding if we can. We're also working on legislation. Two bills that have actually been signed into law by the governor include one of my bills, which increases farmer and farm worker awareness of Lyme. And we also established a tax checkoff for Lyme and tick-borne disease research and prevention. Actually, that is a Harcum bill, sorry, but a tax checkoff for Lyme and tick-borne disease research and prevention that was signed into law. And another Senator Harcum bill that is currently on the floor calendar, so could be called to the floor of the Senate at any day, is requiring the state to track Lyme-related deaths, which I think is really important to give us this insight. As we've said, we've compiled an incredible group of local experts for and around our district. And our panelists today are Dr. Richard Ostfeld, disease ecologist with the Cary Institute of Ecosystem Studies. We have Kathy Nolan, who's a senior research director with Catskill Mountainkeeper. John Thompson, director of the Catskill Regional Invasive Species Partnership, or CRISP, at the Catskill Center. And Barbara Campbell, who is a master gardener with Cornell Cooperative Extension, or CCE, of Ulster County. And we will be providing in the comments of this Facebook, you can find their full bios to learn more about each of our experts. We will also, after we hear from them, be taking questions from the audience. So we received a number of submitted questions before, but if you have any new question, please put them in the comments. We will be monitoring them. And as we get towards the end, we will ask as many questions as we have time for. So first and foremost, thank you everyone for tuning in. Thank you to those of you who are watching this after this session, who are tuning in, because it will be archived on our Facebook page. And thank you to our incredible experts, not just for being here today with us, but for the work you do in helping people navigate the beautiful outdoors where we all have the privilege to live and call home, and making sure that we stay safe, that our families, that our neighbors stay safe, and that our pets stay safe. So let's start with our first speaker. We will kick things off with Dr. Richard Ostfeld, who will give us an overview of tick biology, tick-borne illnesses, and share a little bit about the impact of climate change on tick-borne illnesses. over to you.
Okay, well, thank you very much, Senator Hinchey. And I would like to offer my thanks to both you and your staff for organizing this very important webinar. We do know that information about ticks and tick-borne disease can actually work to help keep people safe. So these events are quite important in a public health realm as well as just for informational purposes. So I'm going to share my screen and launch into some brief comments. There's a lot of information about ticks and tick-borne diseases, and I love talking ticks, so I will force myself to stay within the time and only select certain highlights of things to share. So I go to there. I do believe you should be seeing my screen and even my cursor. Okay, super. So I want to describe a little bit of what we've learned over about the past 30 plus years that our research team at the Cary Institute have been looking into tick biology, tick-borne disease risk. Some of what we learned about what affects our risk of exposure to Lyme and other tick-borne diseases. And I want to emphasize right off the bat that it is not just Lyme anymore. Lyme disease is the most commonly reported of the tick-borne diseases in the Northeast and in fact in the entire United States. But it's one of 3 prominent and growing tick-borne diseases. And these are data from the CDC showing the statistics on the numbers of reported cases of Lyme disease on the left caused by a spirochete bacterium, anaplasmosis in the middle caused by a different type of bacterium, and babesiosis here on the right, which is caused by a protozoan parasite related to the malaria parasite. All 3 of these diseases are rapidly increasing in the number of cases that are being reported throughout the country. And although Lyme disease is by far the most frequently reported tick-borne disease in our country, anaplasmosis and babesiosis look like they may be catching up. And that is certainly true in our region, in the Hudson Valley region. We also know that these statistics from the CDC are vast, they're gross underestimates of the actual number of cases of tick-borne disease. And some research teams have attempted to rigorously estimate how bad are we doing in estimating these? To what degree are we undercounting the number of cases? And the answer is we are grossly undercounting them. That in fact, although there are typically about 40,000 reported cases of Lyme in the US every year, new cases, that we should multiply those by a factor of 12. There are actually about 500,000 new cases of Lyme disease in the United States every year. Now, these diseases are not evenly distributed across the country. So these are data from the CDC, from Lyme disease around the turn of the millennium. And it shows that Lyme was clustered in 2 areas. One is in the upper Midwest in Wisconsin and Minnesota, and the other is along the eastern seaboard in this fairly narrow band from southern Maine down into Maryland, with the Hudson Valley in this really dark zone right here. So we are in the epicenter and have been for a very long time, where we receive the brunt of the impact of this important disease. But if we fast forward a mere 16 years, so fix your eyes on this map for a moment, and now look at the data from 2017, we can see how dramatically cases of Lyme have spread in our country. It now engulfs virtually all of New York State and our neighboring states, yet we still in the Hudson Valley are in the hot zone. It has not gotten any better, it's gotten worse. And this geographic spread is in part responsible for the growth in numbers of cases that I just showed you throughout the United States. So the title of this webinar is Let's Talk About Ticks, which is something I love to do. And what I'm going to do briefly is give you the life cycle of the black-legged tick, shown here, slightly larger than life size, coming at you. And the life cycle of the tick is quite fascinating. I will only point out a few features of it. One feature is that these tiny little animals live for 2 years. That's much longer than most animals of this small size actually live. So if we start with eggs, eggs are laid in the wintertime or late fall. Those eggs hatch into the larval stage. There's my cursor. The larval stage emerges from those eggs. They hatch in late summer, typically about August and into early September in our region. So these larval ticks are very tiny, and they immediately start to look for a host animal. It turns out that those larval ticks hatch from eggs free of infection with any of those 3 tick-borne pathogens. So the larval ticks may bite us without us ever being aware because they're so tiny and hard to detect. But there are no health consequences of these bites from larval ticks. So they can't transmit pathogens because they don't have any in their bodies. But if that larval tick happens to feed on an infected wildlife host, then it may acquire an infection with the Lyme bacterium or one of those other pathogens, in which case it maintains that infection for the rest of its life, and it can transmit it later on when it reactivates as one of these other stages and feeds on us or our children or our pets or a wildlife species as well. So the larval ticks feed only once for about 3 or 4 days, and then they drop off the host and they go into a state of suspended animation all winter long, all fall and winter, and then they emerge the next spring or summer. And we are about to experience the peak of nymphs, which tends to occur a little later in May into June and early July. So the timing of this event is excellent. We are about to experience the high risk period of time. The nymphs then look for a host. Again, they're not very picky. They'll feed on almost anything, any mammal or bird that they can find. And it is then that they have that first opportunity to transmit the infection if they got it during their larval blood meal. They take a blood meal for 3 to 5 days, molt into the adult stage, which feeds later in the fall. They reproduce and start the cycle all over again. So our interests, we know with quite a lot of scientific rigor that the great majority of Lyme disease cases and anaplasmosis and babesiosis cases are transmitted by the nymphal stage. That's the troublesome, dangerous stage. So one way of looking at this is that if we know now from our studies that those larval ticks, this represents a cohort of larval ticks, if they happen to feed on a white-footed mouse, this cute little animal that happens to be a very dangerous animal from our health perspective, if they happen to feed on a mouse, they have a very high likelihood of acquiring an infection with all 3 of those different disease pathogens, in which case they molt into an infected nymph represented by these red ones here. And those are the dangerous ones that we need to avoid and somehow control if we're going to keep ourselves and our families safe. So when we want to understand our risk of exposure to these tick-borne diseases, we need to know how many infected nymphs are there crawling around in the forest and in our yards, in our gardens. And we want to know for how long are those nymphs active. That is what represents our risk of exposure to tick-borne disease. So the first question, how many ticks are there? We know from research over the past 30 plus years at the Cary Institute that lots of mice, if there are lots of mice running around in the woods, in the fields, that means there will be a lot of mice available for those larval ticks to feed on. And that means the next year, there will be a lot of infected nymphs that can make us sick. We also know that mice fluctuate in numbers. There are some big mouse years and some years where there are very few mice, hardly any at all. And we know we can predict a big mouse year based on how many acorns were produced the prior fall. So we can actually anticipate years in which there will be lots of mice, and we know that those are followed by years that there are lots of infected ticks, so we're in danger. We also know that there are hot spots in the landscape for mice, that mice are not evenly distributed. They tend to be most abundant in degraded and fragmented habitat. So an example of that is shown here, where there are plenty of mice. There are mice in intact extensive forests, like in the Catskills, in other forested areas within our region, but they particularly thrive in forest fragments or in degraded forested land. And that is because many of the predators and competitors that can control their population size decline or disappear. So, and this is a particular problem when we plunk our houses down right next to these danger zones that we have created inadvertently by fragmenting the landscape and reducing biodiversity. The mice do really well in places like that. So finally, for how long are those ticks out there and able to bite us? And we know from our studies, again, over multiple decades at the Cary Institute, that climate warming gives the ticks more time to find a host, which they have to do if they're going to survive. We know that as the climate warms, spring starts earlier, and we also know that winter starts later. So on both sides of the tick activity season, we are providing inadvertently for the ticks more time to find a host, which makes it more likely that they will survive, reproduce, and infect us at the same time. So just to summarize quickly before we move on, we know that Lyme disease risk is elevated when mouse abundance increases in time, and that follows acorn years, so we can predict high-risk years. We know that it's elevated when forests are fragmented, and that's a result of predators on mice declining in abundance. And we know that risk is elevated as the climate warms. So I want to close by acknowledging support from various funders, and then I will close my comments and stop sharing my screen if I can move this up. And I will be happy to introduce the next speaker, who is Kathy Nolan, MD, who is the Senior Research Director with Catskill Mountainkeeper. And take it away, Kathy.
Thank you very much for that, Dr. Ostfeld. I am a physician, and so I've been interested in Lyme disease for a long time. And I'd like to make my comments tonight for people who are coming here, maybe who either have Lyme disease or a Lyme-related disease, that babesiosis or anaplasmosis or lichiosis, or who know people who have those diseases, who want to know more about ticks and prevention, but also want to know, why is Lyme so bad? It is a very difficult disease. And so I'd like to give a perspective on that that looks a little bit at the microbiology of the spirochete that causes Lyme disease. Also want to say that I'm not offering any specific medical advice here. I am a physician, but not a physician who is seeing patients for Lyme disease currently. And as you'll see from my comments, it'll be really important for anybody who has Lyme or is worried that they might have Lyme to find a clinician that is very active in practice and staying current with a lot of developments that are coming along to help us. I don't have slides. Instead, I'd like to talk with you about a few elements of Lyme and the organisms that cause Lyme to give you just a little context for how this disease could have come on the scene and hit us like it has. It has to do with the Lyme spirochete being a twisting form of bacteria. That's what spirochete means. It has a spiral form. And the spirochetes are pretty unusual as bacteria. A lot of bacteria are either round or rod-like, but spirochetes can cause a lot of very difficult conditions because they can burrow into tissues with those little twisting shapes that they have. And the most famous spirochete is this organism that causes syphilis. And syphilis, you may know, was a terrible disease before we were able to learn how to prevent it and treat it. Syphilis was called the Great Pretender because it caused so many different kinds of symptoms in the body. And that's the same situation that we see with Lyme disease. So the organism can cause multiple different symptoms, and it causes multiple different symptoms over time during an infection. So I like to talk about early Lyme, mid-stage Lyme, and late-stage Lyme disease. Early Lyme disease is really from the time of a bite through maybe the first few weeks in which a person is exposed and then becomes infected. And the early symptoms are fever, headache, fatigue, and sometimes, but not always, a characteristic skin rash called erythema migrans. It means a bullseye that grows. It's a growing kind of rash. And there are other kinds of rash, atypical Lyme rashes, that we may see as well. Those are fairly common symptoms. You know, fever, headache, fatigue can feel like a bad cold or the flu. The key would be if you experience that during a time that's not cold and flu season and a time when we're out in the woods and we're being exposed to the ticks that carry these organisms. Mid-stage Lyme comes in the next several months following that initial infection if it is not treated. And that includes inflamed joints, nerve paralysis, muscle aches or twitching, and cognitive symptoms, especially memory loss and sometimes visual changes. In late Lyme, months to years later, again, if untreated or without successful treatment, you can see all of the mid-stage symptoms, plus very arthritic joints, heart block, which is due to the conduction system of the heart being affected, fatigue, nerve paralysis, more cognitive decline, sometimes gastrointestinal symptoms. So part of the way that we deal with Lyme is to be aware of this constellation of symptoms and to think about the possibility that a person may be infected. The diagnosis of Lyme early in the Lyme history, which goes back now several decades, was an ELISA test or a Western blot test, and sometimes a culture. Now, I think that the gold standard for diagnosis is a DNA test. That is the best way to identify more people who are infected accurately and not to confuse a diagnosis of Lyme with other conditions. Lyme can look like chronic fatigue syndrome. It can look like rheumatoid arthritis. It can look like Parkinson's disease, but each of those is a little different. Chronic fatigue doesn't usually have muscle stiffness, which Lyme usually does. Rheumatoid arthritis doesn't have the neurological symptoms or the muscle stiffness, memory loss. And Parkinson's disease does not usually have joint pain. So we can often distinguish those. There is another condition called fibromyalgia, which has all of the same symptoms as chronic Lyme disease and can be very difficult to differentiate. But the new DNA tests, which have come in over the last couple of years, can be helpful there. So what do we do when we have this type of condition that can become so severe and long lasting? Prevention is the heart of this, and we're going to have several of us speaking about this in terms of keeping ticks off and keeping ticks from biting, removing ticks properly, and also using repellents and washing our clothes as ways to keep from being bitten. But what happens if you are bitten? If you know that you have been bitten, there is a little bit of time from the time the tick bite happens before the organisms actually cause an infection. So that period can last from a few hours to a day or two, or as long as a week. And there's a way that you can use antibiotics during that period that's called prophylaxis. You're actually taking an antibiotic, usually doxycycline, sometimes erythromycin if doxycycline isn't an option for a particular person, and taking that in a high dose, but for a short pulse, a few days. The longer that the tick may have been in the skin and into the bloodstream, the organisms from the tick's mouth into the bloodstream, the longer the course of antibiotics. If you are not able to do that prophylaxis and you start to see symptoms, or you do the prophylaxis and then you see symptoms, there's early treatment, which is similar to the prophylaxis, but goes for a longer period of time. So if you have fever, headache, fatigue, and a rash, treatment with high-dose doxycycline, which I consider at least 300 milligrams a day, for a longer period of time, 1 to 2 months, because the life cycle of this organism inside humans is about 30 days. And so treating for only one life cycle may not be sufficient. If we are faced with a situation of somebody having late stage symptoms, then antibiotic treatment can be helpful. If there is a good diagnosis, you can use multiple antibiotics, much as we used to do for severe syphilis, and you use long courses. This is the approach that what I will call Lyme literate clinicians use. They use DNA and RNA for diagnosis, and they treat what is called chronic Lyme and co-infections, rather than what the Centers for Disease Control actually recommends, which is just 30 days of treatment with 200 milligrams a day of doxycycline, which I consider to be not a full treatment dose. This spirochete is not killed in the human body by 200 milligrams a day of doxycycline. That dose is what we use for respiratory infections and other simple kinds of infections. This organism, I think, needs something more. But that's not the conventional view and not the official view from the Centers for Disease Control. But Lyme literate clinicians who know the microbiology of these organisms, I think, can push the edge on what we are able to do with treatment and have success in some patients that have not had success with what is conventionally offered. I've also found that some herbal treatments can be helpful. I have never prescribed those. I'm not trained in the use of those medications, but there are herbalists who can do that. And I think energy healing can also be helpful because the Western medicine is not as good at taking care of the joints and the system of connective tissue as many Eastern forms of Eastern forms of healing. And so looking into alternatives, especially if you have tried conventional medicine and it hasn't been successful, can really be helpful. So I think that if we look at this condition as one that we can prevent by keeping the ticks from biting us, that we can treat early if at all possible, and that we can treat with really state-of-the-art medical care, and I hope funding for research so that we're able to investigate how we can get better results than conventional medical practice can give us. I think we can really keep this from being a bigger problem than it is already presented. So I'll stop there and introduce our next speaker, who is with the Catskill Center, John Thompson. He is also the director of the Catskill Regional Invasive Species Partnership, CRISP, and I think he's going to talk about prevention while hiking and outside and what to do if we find a tick. John?
Thank you, Kathy. Can you see my slides? Great. Thank you. Let me see if I can minimize this. So what I want to concentrate on is prevention. And I think for prevention, preparation is critical. Before you go out hiking, go for a walk, go fishing, go hunting, walk your dog, you should consider where you're going and what are the appropriate clothes that you'll need when you get there. For areas where there may be ticks, wear closed shoes and light colored socks, pants, long sleeve shirt, as this person in the illustration is wearing. Also have a red arrow here. I think that he should be tucking in his shirt. You want to keep the ticks on the outside of your clothes and not let them get underneath your clothes and under your skin. And consider wearing treated clothing. I use permethrin It's an insecticide that works to repel ticks. You can spray clothing, especially your pants, socks, and shoes, but also your long sleeve shirt. This type of treatment lasts 4 to 6 weeks, or 4 to 6 washings, or 6 weeks. And you can also buy clothing pre-treated. The permethrin lasts 70 washes on pre-treated clothes. You could send your clothes out to get treated with permethrin. Or if you're not using permethrin, you should be using some alternative repellent, and we can talk about those. When you're outdoors, remember that ticks are in low vegetation, usually within about 2 feet of the ground. So you'd pick them up on your shoes, your socks, or your pants. So tucking your pants into your socks and tucking your shirt into your pants, as I mentioned earlier, would keep the ticks on the outside of your clothes. Situational awareness is really important when you're outside. You want to avoid areas of thick, low vegetation like tall grass and thick leaf litter. Try to stay in the middle of trails. If you're not in the middle of the trail and you go off the trail, either to bushwhack or at the edge of the trail, you may be exposing yourself to more ticks. You can see most of the people in the upper illustration here are on the trail. There's a person that's off the trail who's wearing shorts, and she may want to be coming back onto the trail and checking herself for ticks. In the middle illustration, you can see there's a bird watcher here who's well dressed for being out in the field. He's wearing a long sleeve shirt, long pants, but he's in low vegetation and should be doing frequent tick checks. There's an angler out here who had to walk through this vegetation, should check themselves for ticks, even though they're standing in the stream. The people most at risk here might be these scouts who are gathering firewood and they've been walking through low vegetation. They should get back to the trail and check themselves for ticks. And then just to point out, there's a lot going on in this lower illustration here. There's some young people playing soccer. This child is out in the low grass kicking the soccer ball around, but this child here, if you can see my cursor, is out in the low vegetation. He was prepared to be in the mowed grass, but unfortunately kicked his soccer ball out here, so has gotten into the thick vegetation where there are more likely to be ticks. So an adult should be checking that child for ticks before they get back in the car. And I'll just emphasize again, situational awareness is really important here when you're outside. So you should check for ticks frequently on yourself and the people that you're with, especially if you just went through the low vegetation that we're talking about, and more often if you're not dressed appropriately, like those scouts and the children that we saw. Some people use lint rollers or tape to get ticks off their clothing, and you should check for ticks at the end of your walk and before you get back into your car. And when you get home, what you want to do is check yourself really closely. When I first get home from being out in the field, when I first come into the house, I remove my clothing, put it in a plastic bag so that ticks aren't crawling out of it, getting onto the floor and onto my family. You could also put your clothes in the dryer for 10 minutes on high, and that will kill ticks. And I usually take a shower as soon as I can. It gives me another chance to look for ticks. My wife will check me over before I get in the shower, and that's the places that you want to really look for ticks are illustrated here. What I would say is places where there's a constriction of clothing, and it's often around your hips at your pant line. It might be around bra straps or other places where the clothes are constricting your body. It's great to have a partner check you for ticks because you can't see the backside of your body very good. It's good for adults to check children. If you don't have somebody to help you check your body, then it's good to have a mirror to be able to check the back of your scalp, behind your ears, and things like that. So if you do find a tick, it's really important that you remove it promptly and properly. What you want to do is have a clean, fine tip pair of tweezers as shown here, and you want to grasp the tick by the head as close to your skin as you can, and you want to slowly pull it away from your skin. You don't want to jerk it. If you don't remove the tick properly, you could be breaking off the mouth parts within your skin, and they could be stuck there. You don't want to remove the tick with your hands or squeeze it with your fingers, because that could squeeze their gut contents into your bloodstream. After removing the tick, thoroughly clean the bite area in your hands with soap and water and rubbing alcohol. Never crush a tick with your fingers. Dispose of a live tick by putting it in alcohol or placing it in a sealed bag or container. I often label those bags with the date that I got the tick, what type of tick it might be, or if you could just flush the tick down the toilet if you want to get rid of it. Kathy offered some advice for what to do if you see a rash, and what you could talk to your doctor about. So go over that again. And but I would like to just remind you to be mindful of ticks and be prepared before you go outside, before you get into an environment where you might be exposed to ticks. Have light colored clothes that may be treated or apply repellent to them. Be aware when you're out there of low vegetation areas and when you're walking through it, even if you're just stepping off the side of a trail. Do frequent checks when you're outside to see if they're crawling up your pant legs, and be prompt if you do find a tick, remove it and properly handle your clothes when you get them back inside. And now I'd like to introduce Barbara Campbell, Master Gardener with Cornell Cooperative Extension of Ulster County. Barbara will speak about tick prevention around the home while gardening and with pets.
Thank you, John. So Cornell has for years been trying to get people to do integrated pest management to control their gardens. And this means that the first thing you're going to do is manual or mechanical, and then you go up until you perhaps are going to go with some sort of a chemical prevention. But we tried to start manually and the easiest way without getting into any of the chemicals. So for your house and your garden, the first thing is to keep your lawn mowed short, about 3 inches, not to scalp it down to like a ½ inch with, the lawn won't even grow, but 3 inches. Now, I think you've probably all heard recently, there's a movement to go for no mow May. I think in the Hudson Valley with our tick conditions as they are in May, that's not a very good policy to follow, although there are people that are trying to get us to do it. I know in New Paltz, there is one house on Main Street that has a sign saying they're not mowing in May. Keep the grass, the tall grass and the brush, clean it up. Don't let it get, anywhere near where you're going to be out in your yard. And another thing is to form a 3-foot barrier of wood chips or stone around your entire property if it's possible, or if you can't do it around your entire property, do it around where you're living, your patio, your children's play area, your swimming pool, somewhere that you're going to be out and about. Put a 3-foot barrier, again, of wood chips or stone. And then restrict the use of ground cover around your garden. Pachysandra is one that we all use a lot, or vinca, and try to restrict that because the ticks would be attracted to that ground cover. If you have any wood on your property, make sure you stack it away from the house and in a dry area. Make sure you rake up all your leaves and remove your trash and trim your trees. bringing more sunlight to the garden, because the more sunlight you have in your yard, the less ticks will probably be in there. Again, bringing sunlight to the play areas or your patio areas for your children. Another practice that Cornell recommends, and we have a garden at Ulster County Community College, which is an example of xeriscape gardening, which is you're not going to do much watering. The more dry your garden is, the better it is to keep the ticks away. And again, I think it was mentioned before, diversity. The more native plants we use and the more diversity in our gardens, the healthier they will be and the less likely to have ticks coming in. I know John mentioned what to do about what you wear. And just to repeat, light clothing, put your socks over your pants, wear long sleeves. These are very important. And then, of course, to check yourself every night for ticks before you go to bed, from the top of your head to the bottoms of your feet. Unfortunately, we're living in an area where that's necessary. Now, as far as pets are concerned, pets can use different tick preventative chemicals. They're not going to live the life expectancy of a human, so it doesn't bother them as much to have these chemicals. And that is one way to keep your pets from bringing ticks into your house. Again, I think Dr. Nolan mentioned that the CDC is recommending that you take a low dose or a small dose of doxycycline if you do have a tick on you for a very short period of time. You're examining yourself at night before you go to bed and you find a tick, you knew it wasn't there the day before. So take it off and then follow the CDC guidelines for that. I'd also like to just put a pitch in for the Master Gardener Hotline, which is at Cornell Cooperative Extension in Kingston. And Master Gardeners are there every Monday, Wednesday, and Friday to answer any gardening questions you might have. And the phone number for that is 845-340-DIRT, D-I-R-T. And at this point, Senator Hinchey is going to be hosting question and answer period.
Thank you so much. Thank all of you for your insight and your expertise and for taking some time to highlight these really important things to do. A couple of things. One, on the clothing piece, it's so kind of the opposite of what we want to do when we go outside, right? It's warm. We want to go hiking. We want to be in the weather. We want to get like a nice little tan safely while we're walking around. You don't think about wearing long sleeves when you want to go on a hike because you know you're going to get hot. But in our communities and in the Hudson Valley especially, to keep yourself as safe as possible, that's actually really pants and long sleeves, definitely pants and socks over the pants has always been what I was taught. And, ticks in the ears, I've gotten ticks crawling in my ears. And thankfully my mom found it once and was able to take it out before it connected. But they get in all the little crevices and spaces because they're so small and they're looking for those kind of darker places. Am I right? That's kind of the spots that they're looking to connect into. So thank you for, this insight. And I think seeing too, Dr. Ostfeld, the shift from 2001 to 2017, especially in our community, that map of the proliferation is really staggering. And, I think anecdotally, we all experience that. But to see that kind of image and those numbers really puts into perspective what it is that we're facing and why it is so important to be so diligent. We'll shift. We've gotten some great audience questions. Some we've touched on, but good to compare and really put a fine point on some of these issues. You had mentioned, Barbara, I think it was you or John, that after you're outside, kind of common knowledge is to put your clothes in the dryer. Putting them in the plastic bag, maybe to transport it to the dryer is probably a good idea too. But is that enough to really kill the ticks? Is putting it in the dryer, will that be enough when you get inside?
They've shown that with an electric dryer, it takes a little longer, but they say 10 minutes on high. And so you want to put the clothes in there if they're dry. you could put them right in the dryer. If they're wet, it would be different. That it would take longer to kill them. A gas dryer, I think it's 6 minutes. It goes a little hotter. But yeah, I put my clothes in a bag so that they'll be isolated, and the ticks will be trapped in that bag if they crawl off until I can wash the clothes or dry them or whatever I need to do with them. Right.
So do you put your clothes in the dryer before you wash them? I'm always inclined to wash them, get the any repellent that I've used off them, and then into the dryer. Am I possibly having more risk of the ticks surviving that than if I went to the dryer first?
I'm not sure. Maybe Dr. Ostfeld knows in terms of how they could survive in the washing machine.
Well, they survive the washing machine remarkably well. You can submerge ticks in water, and their metabolic rates are so low that depriving them of oxygen for a few hours is not really a big deal. So if you put your clothes in the washer first, you're much less likely to kill the ticks. That's the dry heat that kills them. Moist heat is actually kind of nice for them. They like a sauna, or a steam bath, but the actual dry heat. So if you're attempting to kill the tick, you want to put your clothes directly in the dryer without having them washed first, if that's your point. If you want to clean your clothes, it doesn't work so well.
Dryer, washing machine, dryer. Once you've been outside.
That would work, yes.
Wonderful. Learn something very important here on this call. Thank you. We have a couple repellent questions. We had heard about permethrin, I think, John, from you. What helps the most, picaderidin or permethrin?
From what I know, the permethrin's more effective. It can work for deer ticks. It's very effective. They have smaller bodies, and it will repel them. It could be lethal to them if they're exposed for it for a long time. There's some gators that you can buy that are have like grids. They're really three-dimensional, and it's supposed to get the ticks like very exposed and with the permethrin as they're trying to crawl up your gators to get to you. But the larger ticks, like the wood ticks, they're more likely to be able to withstand higher doses of the permethrin, I found. But what I found is the permethrin seems to be pretty effective. And it's something that I rely on now when I'm going out bird watching or I'm working out in the field.
Thank you. We have a critical care nurse who also submitted a question about what is best to spray on on someone's clothes, because she sees the impacts of Lyme disease frequently in her hospital. And so I think that the takeaway is permethrin is probably a great something to invest in before we go out to be protected.
Yeah, and I could just add to that too, like if you aren't comfortable with permethrin or you don't have it, then I would use one of the alternatives. You should use something on your clothes or on your skin when you are outside.
I like permethrin. I like permethrin a lot, and it's low in toxicity to humans and to most other living beings. It is somewhat toxic to fish. But it generally has a very low toxicity. For people who don't want to use any chemical, oil of lemon eucalyptus is actually shown to be effective. And so it is a product that I will look for and use quite a bit. And the EPA has a very nice list that goes from DEET up through catnip oil, which also has some efficacy. And you can click on each of the products and get more detail about how it is toxic to humans and other animals. I think that each person needs to use something, especially if they're going into areas where the exposure is very likely.
Thank you. And you answered my next question, which was lemon eucalyptus oil that was submitted. So thank you.
So lemon eucalyptus oil has been shown to be effective. Eucalyptus oil alone is not really so effective. So if you're looking for a product, and the catnip is from the mint family. So if it's another herbal type of preparation, very low in toxicity, in fact, edible. So if you're looking for non-chemical approaches, I would say lemon eucalyptus or the catnip, the mint family catnip.
Thank you. I think that's important to know all of our options, especially, people have different abilities and levels to intake. So that's great. We have a question submitted for Dr. Ostfeld. What happens between the nymph and adult stage with respect to infection from a tick bite? Why is nymph more dangerous than the adult?
Great question. So both nymphs and adults can be infected with these tick-borne pathogens. So both are potentially dangerous, whereas the larvae are not, as I said. But the nymphs are active in May, June, and July. That's when we're active outside more than other times of year. The adults tend to start becoming active in November, December, and then any warm day over 40 degrees or so throughout the winter and early spring. So that's when people are less active outside. The nymphs are quite tiny, about 1 millimeter, the poppy seed sized, so extremely hard to detect with your eyesight or by feel when the nymphs are crawling on you or even embedded in your skin. The adults are much bigger. I mean, they're still small, but they're like a little bigger than a sesame seed, so quite a bit bigger. So not only are the adults active when we're less active outside and more heavily clothed as well, but they're also much bigger and easier to detect. So the onset of symptoms of Lyme disease across the country can be superimposed almost perfectly on the activity peak of the nymphs. So that's how we know that it's really the nymphs that we need to worry about. There are some cases transmitted by adults, but they're comparatively very few.
Thank you. That makes a lot of sense, but it's something, I think is helpful to frame. Next question we have just submitted is, what is the safest preventative drug to use on pets? We all love our dogs and cats, and they get to run around outside and go for walks with us, and often great to be in our backyards, but how do we keep them safe? What's the best one?
I don't have the answer to what is the best one. There are numbers of them on the market, and they all seem to be effective. The only problem with pets and putting something on them is oftentimes the tick won't die right away. The pet comes in the house, the tick is already being exposed to some sort of a chemical and jumps on you because you are not protected. And I know a lot of pet owners have been complaining that they bring the dogs and the cats in and then the ticks come on them. So, but there's many different things on the market that are effective. I don't have a particular name.
And I guess to that point, sorry, Kath, but I'll say important to, when you're bringing your pets inside, to check them over too, and to not forget, and to make sure either right before you come inside to do a quick scan on your pets. And
I would just flag with a little caution any of the pet collars and powders that would use the neonicotinoid insecticide imidacloprid. There have been a large number of complaints submitted of pets with seizures and other reactions that seem to be linked to pet collars that include that particular neonicotinoid insecticide. So I caution against it. It is effective, and people who use those collars say that the animals are protected from the ticks and their family is protected from the ticks. So there's a balancing that sometimes we need to make of the potential harm with the potential benefit, and each family should look at that. But that would be the area where I would have a particular concern. And people can go to their veterinarian and get some guidance for effective treatments and prevention that would be less potentially toxic to the animal.
And the good thing is, well, not the good thing is, but so many of our veterinarians here deal with this on such a regular basis that a lot of them are up to date and very mindful of what is best and what's happening that season. So I think it's a great advice to talk to our veterinarians. We have time for one final question, and I will end with this one that was submitted, open for everybody. Oh, how do we get the mainstream medical society to recognize this debilitating disease?
Well, I think that we're doing some of that with this kind of outreach. The more that people know about all of the aspects of prevention, diagnosis, and treatment, the more they can speak knowledgeably to their representatives. And I think that doctors are waking up to the fact that alternative approaches may be beneficial. There's so little efficacy with conventional treatment that we're forced to look for new things. And we need to look at this, these simple things of protecting ourselves from the infection at all, because we don't have to worry about how bad medical treatment is if we prevent ourselves from getting infected. And maybe think about prophylaxis if you find a tick that's been embedded in your skin at all.
Yeah, I would just like to add to that very briefly that I go to a lot of scientific meetings that have quite a presence of biomedically oriented researchers in addition to more ecologically oriented ones like myself. And I would say that there is a tremendous amount of energy, although that is not matched by a tremendous amount of resources from federal funding agencies or other funding agencies, although that's getting a little better, it's still inadequate in my opinion. But there are a lot of very energetic, very creative, very dedicated professionals who are working very hard on better means not only of diagnosing, but of treating. And these are not necessarily unconventional, non-Western approaches. These are conventional Western ones. They're just done very creatively with all the rigor that Western science actually invokes in asking about efficacy and safety. So there are people working on it. We are seeing improvements. It's a slow process and it's hard to be patient, but we do need to be patient. And at the same time, to whatever extent we can convince the powers that be that resources are limiting to making progress on this, we'll see faster progress.
Thank you. I think the message of talking to all of our representatives, our federal representatives, feel free to call our office and advocate. That actually gives, even though I am supportive and we're fighting for it, the more people who call about it, it does give us the ability to say, there are large numbers. We have to invest in this. This is what our constituents want. Calling assembly members leading up into the budget next year, other senators across our state, and especially our federal representatives as they're planning it and planning bills. And we have some new ones in our region who I know are looking to make big impacts for those people that they represent. So to be really kind of ringing the bell at all levels of government is important. And, it's something that I'm definitely very passionate about. I don't think anyone who lives in the Hudson Valley doesn't know someone who hasn't been impacted by Lyme disease. Many people themselves, but everyone knows at least 1, 2, 10 people who had varying degrees of Lyme disease or another tick-borne illness. And so raising awareness, talking to the experts, and taking precautions while we're still working to get the funding, taking the precautions so that you and your family and your pets can be safe is a really important step. So I want to thank all of our incredible experts for taking some time out of the day today to share their knowledge and their wisdom with us in this space. We only scratched the surface of the details and what we could have talked about. But so anyone who's watching, please feel free to reach out to us. We will share, if there are more questions, we will share them with our expert panel and try to get the answers, possibly share some contact information and places to go to be able to learn more. So thank you all so much for being with us. Thanks to those who tuned in. Please reach out with any other questions and stay safe and raise more awareness about tick-borne illnesses and how to keep each other safe while we enjoy the beautiful outdoors that is the Hudson Valley. Thank you all so much.
Thank you.